Welcome back, everyone. Today is day 3 of your Msra Sjt course, and we are beginning our first in-depth exploration of professional integrity. In this session, we'll cover honesty, candor, and managing errors. By the end of today, you'll be confident in handling scenarios about mistakes, near misses, and difficult conversations, all common in the HT. I want you to remember one phrase throughout today: integrity is non-negotiable. In the Msra exam, and in your practice as a doctor, dishonesty is always the worst option. Candor, openness, honesty, and accountability is always the safest. So let's begin. What do you mean by candor? Let me explain. The duty of candor means you must be open and honest when something goes wrong in a patient's care. Always remember it's not optional. It applies whether or not the patient has been harmed. We try to reference almost everything rather guessing or our own opinion. So the GNC states in Good Medical Practice 2013, paragraphs 55 to 57, that doctors must be open and honest with patients if things go wrong. Apologize to the patient or their family. Offer an explanation of what happened and what will be done to put things right. The NHS also has a statutory duty of candor under CQC Regulation 20. This means organizations as well as individuals must be transparent when care falls short. So candor is both a professional duty and a legal duty. Now, I want you to think, why do you think doctors sometimes fail to be candid? Just take 10 seconds in your head. Common reasons are fear of being blamed, fear of being sued, embarrassment, or not wanting to upset patients. But ask yourself, what happens if you hide a mistake? Trust is broken. Errors are repeated, and patients suffer. That's why candor matters. Now have a look at these few cases. Let's work through an example. You prescribe IV coamoxiclav when the patient was meant to get ceftriaxone. The nurse administers it, and later you realize the mistake. The patient is stable and comes to no harm. What should you do? Think carefully. Option 1. Say nothing, because no harm was caused. Option 2. Tell the patient, apologize, explain the mistake, inform your senior, and document it. Clearly, option 2 is correct. Even though no harm occurred, you must still be honest. This is a classic HGT red flag, concealment. If the stent includes words like error, mistake, or realize later, your mind should immediately jump to candor. Example 2. Another case. A patient with type 1 diabetes misses an evening dose of insulin because of a handover error. You review them the next morning. Their blood sugars are a little high, but they are stable. What do you do? Again, honesty is required. You must inform the patient or their family, explain the error, apologize, escalate to the consultant, and complete a DATX report. Notice that even when no serious harm occurs, the principle is the same: candor, documentation, escalation. Let's pause. I want you to reflect for a moment. Imagine you are the patient. Which doctor would you trust more? The one who hides mistakes, or the one who tells you honestly what happened, apologizes, and explains how it will be prevented next time? That's why candor is central to trust in medicine. So always remember in the exam, whenever you see an option that involves concealment, ignoring the mistake, hiding it, pretending nothing happened, that will always be the lowest ranked choice. Let me summarize this first section. Duty of candor is about being open and honest when care falls short. It applies whether or not harm occurred. The correct sequence is inform, explain, apologize, escalate, document. GNC guidance is clear. Dishonesty is never acceptable. Fault pearl. In integrity questions, cover-up is always worst. Quick recap for this session. Question. You prescribe the wrong drug. No harm occurs. To you. Say nothing and move on. Apologize, inform, escalate, and document. The answer is obvious. Always number 2. In the next session, we'll look at admitting mistakes and managing errors in more detail, including DATX reporting, escalation, and roleplay on apologies. In the meantime, try to focus and remember what we have discussed today.